I'm Dr. Daniel Yinh at the Center for Musculoskeletal Function. Today we're going to talk about runner's knee. We're going to go over our treatment approach that we follow here in the office, and we're also going to talk about some signs and symptoms so that you know when you might be experiencing runner's knee. So when it comes to runner's knee, there can be multiple sites of pain, but the pain is usually in the front of the knee, surrounding the kneecap somewhere here, or a little bit off to the side, involving some of the vastus lateralis quadricep muscle and the IT band. So we have a lot of quadricep muscles that come in and run over the top of the knee. Any dysfunction in the tissue here, including the knee capsule or patellar tendon, or into the knee joint here, can limit the range of motion and cause poor mechanics in the knee and cause dysfunction in the knee. And for that reason, not only do we check all of the surrounding tissue, but we check the range of motion in the knee and see how close that heel can make it to the glute here. Okay, so that limitation lets us know that there is some level of dysfunction in the knee, and now we're going to go ahead and try to hone in on where those areas are exactly. So some of the treatments that we use here in the office are instrument-assisted, manual work, and we also do exercise depending on how much mobility we need to gain and how much stability we need to gain in the knee. So when we're looking at the tissue here, I use this instrument to do instrument adhesion release and find exactly where those areas of worst dysfunction is, and that way I can really hone in on that and start breaking those up. A lot of people describe this as almost like a good type of pain when they start to feel that adhesion release and those adhesions break up, which are like glue to the muscle. Once we break that up, we tend to see quite a bit of change in the range of motion in the knee to help us regain function of the knee. So another type of treatment that we use is hands-on treatment to get rid of some of the adhesions in here. And we'll palpate and find the worst areas of adhesion. So I'm feeling a pocket here. And we'll take our contact and, we'll have the patient move under tension. And again, many of my patients describe this as a good type of pain, and they can feel that release. And then we'll recheck the range of motion and see what changes we've made. And then we know if we've restored some form of function there. And in this case, we have. So as you can see, our treatment approach can make significant changes in how that knee moves and functions, even within the first visit. If you found this information helpful, go ahead and subscribe to our channel, and we'll see you at the next one. Thank you.